Go ahead, Karen.
Thanks, Jen. We've heard reports of hospitals down in Louisiana that are full of COVID patients trying to evacuate some patients. They're having issues of roof damage, some generators failing. Can you give us a sense of the scope of the impact on hospitals in that region and what the federal government is specifically doing about that?
Absolutely. So first, let me say that I know there have been a range of reports out there, but as of late last night, no hospitals had run out of oxygen as of late last night. That is something, of course, that we are watching very closely. We have, prior to the storm, we had more than 300 federally deployed healthcare personnel on the ground supporting COVID surge response in Louisiana and Mississippi. The Department of Veterans Affairs has made beds available prior to the hurricane to support local hospitals and will be available to assist in response, and HHS and FEMA are working to assess, deploy additional assets as needed. So on hospitals, we also have approximately 39 facilities, as I understand, using generator power, and we are, of course, working around the clock to get power back on where we can. But this is certainly an area where we, not only did the president speak purposefully several over the course of the last few months, and many of our high-level officials have spoken out about the need for people to get vaccinated, but we've also worked preemptively to put in place generators, equipment, emergency personnel to help address. And I expect as we continue to discuss with the governor and health administrators, we'll determine what additional assistance we can provide.
Just to follow up on something you said in your opening, that shelters are open in the area and they're implementing steps to prevent the spread of COVID. Can you give us more details on what's being done in those shelters?
There are steps including social distancing wherever possible, which I know sounds challenging, but we're working, that is being worked to implement, masking wherever possible. And again, I would note that the president and several other high-level members of the administration made a strong case over the course of the last couple of months for individuals to get vaccinated. We had seen increases in numbers of vaccination in the region, although not simply not enough to prevent the spread. Go ahead, George.
Can you give us any kind of update on